Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, how are restaurants handling disruptions? But first, nursing homes and COVID. We'll get to those subjects after these words.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, we're going to take up a bunch of important topics on the program. We're going to take them up, but first, let's talk a little bit about nursing homes. Joining me is Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. All right, Zach, it's been what? You were on the program last March.
Yep.
Give us a little update on nursing homes. Where do you stand? We have some specific topics I want to get to, but first, take it.
Well, thanks for having me back. And I think it was actually almost 2 Marches ago. So it was March 2020.
2 Marches ago.
When I was last here. So how long do we have to talk about the update? Here's what I can tell you, Terry. We represent long-term care. That's nursing homes, personal care, and assisted living. We represent the providers, we represent the workers, our healthcare heroes, and we represent the residents, most importantly. Since you and I last spoke, they've been on the front lines of the COVID-19 pandemic. They've been at the epicenter. And we fought and they fought for support, whether it's PPE, testing, staffing, funding. Believe it or not, last year we had to fight just for the COVID-19 vaccine. And I think we're starting to see the benefits of that support, because in December 2020, on average, we were seeing about 2,500 new resident cases of COVID-19 in long-term care. Last year, December 2021, just 250 or 300 per week. We're seeing that support and those resources work. We're not out of the woods
and
yet.
You have not to interrupt you, but I will. You have a population that's really susceptible, perhaps more, pre-existing conditions with other people, but age is a huge factor.
Well, and we've learned throughout the pandemic that it's our population, especially in nursing homes, that are the most susceptible to COVID-19 because, as you noted, the age, the underlying conditions, and the comorbidities. It's why we fought so diligently for that support.
Okay. Since COVID, you've had to put a hold on admissions.
Yep.
Now that can't be something you're. I mean, obviously that's something really important.
In Pennsylvania, in one of the oldest states in terms of our population in the entire country, that's something that should scare everyone. Wow. That's something that should alarm our legislators and our governor. Back in September, we surveyed our members. And we wanted to see what was happening on the front lines. And here's what they told us. Since the beginning of the pandemic, nearly a 20% loss in their workforce. And because of that lack of trained, qualified staff, they had to put a hold on admissions. We have providers who are quite literally turning away senior citizens in need of care simply because they don't have enough staff. And that's causing the bottlenecks that you hear about in hospitals. This is a real issue, and we've got to address it as soon as possible.
Yeah. That leads to a workforce crisis, I would think, that, it was a concern before COVID. And by the way, you're not the only organization that we've had them on the program talking about this, that, there have been situations even before COVID that have produced workforce problems, but you have a serious workforce problems in nursing homes, correct?
And you pointed it out, exactly. We had a workforce shortage prior to the COVID-19 pandemic, but the past 2 years have exacerbated and amplified that issue. And I would go back to our survey. The average nursing home in PHCA membership had 21 or more open positions that they just couldn't fill. And again, that was 4 months ago, and that's led to a hold or restriction on new admissions. So we have many senior citizens who can't receive care in a nursing home or in a long-term care facility simply because we don't have the available workforce.
Yeah. Well, adding to that is the fact that there's something that you refer to as affording care.
Yep.
How does that relate to the situation you've been describing?
Well, it's Medicaid. It all comes back to the Medicaid reimbursement rate. And more than 70% of all the care provided for or provided in a nursing home today is paid for by the state's Medicaid program. But that reimbursement rate hasn't kept pace with rising costs. Providers haven't been able to invest in the care they provide, in their residents, in their workers to meet higher wages, in benefits, incentives. In 2020, our legislature stepped up with the CARES Act for long-term care. Last year, it was the American Rescue Plan. That was about survival. We're looking at 2022 as the year of a Medicaid investment. That's sustainability for our care.
All right, well, let's run to a break. When we get back, I want to talk about implementing COVID-19 with vaccine alternatives, and we'll get to that subject following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, Zach, one of the other aspects of this has to do with the Biden administration's vaccine mandate. How does that affect what you do?
We just talked about a workforce shortage and a workforce crisis in long-term care. Anything that could deter workers from remaining on the front lines could be detrimental to the care that we provide to Pennsylvania seniors. When President Biden made his announcement back in August for this health care mandate, at that time we were about 60% in terms of a vaccination rate for workers. Now we're at 81%, which has far surpassed Pennsylvania's general population. And that's the good news. The bad news is that's 19% of our workforce that could ultimately be taken from their positions, removed from the front lines of care, and forced to get another job in another industry. We can't afford to lose more workers. So we've got to look at alternatives, like biweekly testing, for instance, which many companies and many long-term care providers have already done.
You know, and we talked about this with other employers in a whole range of subject areas. It's remarkable how consistent the workforce shortage is and what that's meant to providing services in a whole array of I'll say policy areas, but it gets down to where people live and where they work and what they do. And it seems like there's no area of our society that is eliminated from that discussion.
That's exactly right. And actually, just a few weeks ago, we looked at the workforce crisis not only in long-term care, but in health care throughout Pennsylvania. So whether it was hospital systems, home care, EMS and emergency services, or long-term care, we introduced a plan for short-term solutions to bring more staff to health care and to the front lines so that we can ensure we can continue to care for our population no matter what setting they're in, whether that's regionalizing the issue, whether it's using American Rescue Plan stimulus funds for recruitment or retention bonuses, or whether it's looking at other states to see what they've done successfully.
Yeah. Well, one of the other aspects of this is that you need innovative policies to support a workforce. I think you refer to it as a workforce pipeline. In effect, get people into the pipeline so you can continue a workforce, because if not, it's already had a big effect on what you do and the services you provide, and it could be substantially increased, the workforce problem.
Yeah,
Go ahead.
Again, we need to attack this issue that existed prior to the pandemic, looking at both short-term and long-term solutions. Short-term, let's get workers, healthcare heroes, to the front lines to provide care. But long-term, to your point, let's build the pipeline. Let's create training programs. Let's bring people back to work so that we're ready to care for our population, which is only getting older in Pennsylvania.
Yeah. Well, before I let you go, one last question. If you had to mention this, pipeline's important. Give me one or two other possible solutions to your problem. I mean, obviously COVID-19, if we get that under control, that has to be a big help.
Yeah, and again, I think it's going back to the state's Medicaid program. Over the last 2 years, we've seen what a lack of investment can do. It has really handicapped long-term care providers in their fight against this virus. If we invest, if we provide sustainable reimbursement rates, that will allow providers to fight COVID-19, to invest in their workforce, and to safely care for their residents.
Yeah. Well, look, I want to thank you for coming in. All right, coming up, we're going to deal with restaurants. I don't think we've dealt with restaurants and how they're avoiding disruptions. We all like to eat out, right?
I do.
And we'll see if that's going to continue in either uptick, downtick, or where that all goes after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Crossstate Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
All right, joining me now is Jim DeLisio. He's the Vice President of the Pennsylvania Tavern Association. I'll tell you, Jim, we go from nursing homes to restaurants and taverns, and quite frankly, they have a little more in common than you might think, given what's going on with COVID and workforce shortages and all sorts of things. But first of all, what's your typical member? When we talk about Tavern Association, talk a little bit about who are your members? What are they like?
First of all, Terry, I'd like to thank you for inviting me to speak on behalf of the taverns. Our typical membership is the small mom and pops. We're not Olive Gardens, Applebee's, the big chain national, international restaurants. We're the local corner bar where the average blue-collar worker goes in. There might be 80 to 100 stools in there, maybe 4,000 people a month. It's just your typical low-key bar and restaurant. It's not the big guys.
Neighborhoods.
Neighborhood bars.
Serving the people in neighborhoods, in local communities. Big cities as well as small cities, as well as rural areas as well?
Correct.
All right, well, let's talk about the finances. COVID, obviously, just as we talked about with nursing homes, has had a profound effect on the business, correct?
Correct.
All right, talk a little bit about that.
Well, back in 2016, way before COVID, they had Act 166, which basically took our ability for carryout away from us, which was the first financial crisis that we ran into. And our business sales were down 35 to 42%. So as we started to redesign how we ran our business to get away from carryout, COVID hit. And then the shutdowns and the mandates and the limited occupancy and stuff. So it was one right after the other that created this problem that we're still dealing with today.
Yeah. So in addition, obviously, to serving food, you also have alcohol to go, beer, I should say, beer to go, six-packs, as you
Correct.
would call them. Is that a significant part of the local business?
Well, it used to be.
That's what I mean.
It used to be. It used to be a very vital part of the business. But then again, Act 166 gave that ability to the beer distributors and whatever. So the damage, like I said, the average damage was like 35 to 42% in lost revenue just in the sales of to-go beer. So, yeah, that was the start of this whole process that we're dealing with.
So you're probably losing more people, but is there any place, any area where there's an uptick in in taverns, as you put it, or are they
Well, I mean, the people that do come obviously are less than before and pre-COVID because people are still following protocols and have some issues with the vaccinations and the cleanlinesses of places. So they're staying out. But what we're seeing is the people that are coming are very generous and courteous and trying to help these businesses survive because, I mean, I think we're at like almost 20% of the local businesses are closing because of this.
All right, let's run to a break, and we come back. I want to talk about living with the virus, takeout food, obviously 6-packs, as you accurately point out, gone. Are people doing more takeout? Or are they coming back now that we'll have to see where the COVID goes? It looks like it may be on the downside in many parts of Pennsylvania. We'll get to that and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, let's go back to a couple of subjects we've been talking about. We have COVID. You also have to live with that. How have restaurants lived with that? Taverns live with that?
Well, we've been adapting since day one with the government mandates and rules, and you can be open, you can't sit at the bar, you got to do this, all your utensils have to be throwaways. So we're constantly evolving with COVID, and we need to learn how to live and conduct business with COVID. And I think that, one of the things that we could do is to try and get a little bit more help from the government in understanding the things that we have to do on a daily basis.
Yeah. Are you doing a lot more takeout? Are restaurants doing a lot more takeout because of COVID?
Yes, that's one of the things that where you used to sit down and have a meal with your family at a restaurant or whatever. Yeah. People are just having it delivered, or they're just picking it up out in the parking lot. So there's a lot more takeout than there used to be.
Yeah. So obviously, as you point out, services are limited. You have more limited hours and reduced occupancy. That must have a profound effect on taverns.
Oh, it does. It decimated quite a few of them. I mean, we have 15 to 20% of them that closed permanently, some of them that were in business for over 30 years. I mean, between the workforce shortage, people not coming out, people not supporting, it's just very hard to try and stay in business. And then you have people that don't want to work, that you can't get anybody to show up for work. So it's just created this problem that just seems to be never ending.
Yeah. You also provide some information. You say about 15% of our members have closed permanently since March of 2020.
Yes, one of the issues is, the government, I think, had all good intentions of coming up with money with the PPP loans and some government grants. The problem was it took so long to go through the paperwork. By the time anybody was eligible to receive any of that money, they were already closed because nobody was coming in, or they were closed because of mandates. Their bills never stopped coming in, but the government said that we weren't allowed to have anybody in our businesses for quite a few weeks.
Yeah, and so when they get laid off, they go into other industries. I mean, are they finding employment somewhere else, or?
Well, yeah. I mean, a lot of them have left the hospitality industry completely. And then the other issue was, between the supplementary unemployment and some of the other monies that were given by the government, it kind of created a workforce that didn't want to go to work. And now when they come back, they're addressing us with, well, I'd like to come work, but I don't want to do nights. I don't want to do weekends. I can only work so many hours. I don't want to affect my unemployment. So it's this constant juggling game of trying to figure out where they meet the criteria that we need and still be able to get the job done so we can serve our customers effectively.
Yeah, that's a good point. That has to be difficult to operate a business like that. I mean, the flexibility with the employees in order to keep some employees on the job and provide the services to people is very, very complex and may well decide whether a tavern stays open or not.
Well, that's exactly what's happening now is based upon the people that come and your ability to keep your employees determines whether you can stay in business or not. And I mean, these employees, you have to applaud them because they put up with a lot of stuff in a week's period of time between people that are totally anti-vaccine, anti-virus, whatever, and then other ones that are very compassionate. So they're fighting the same fight that, you talked about earlier with the healthcare people. It's a constant evolving thing, and that's what we need to do is evolve and change the way we do business because it'll never be the same.
And when we've chatted about this with a whole variety of interest areas on several programs, they've also talked about the situation that they faced before COVID, that the workforce situation was difficult, even before COVID hit. Did you have the same situation?
Not as much as the healthcare, but we did still have work shortages, people shortages as far as people that wanted to be bartenders. A lot of people, they did it as a part-time job to supplement their income. Getting a full-time one was hard. And with the business being the way that it is, it's very hard to keep good employees. You need to take care of them and treat them right and let them know that they're respected and an important part of your business.
And the turnover has to be enormous.
It's tremendous.
And so then you have to train people and go through that whole process, correct?
Yes, we have to have them all RAMP certified, which is a responsible alcohol management program. You spend money to send them to a class, they go to a class, and then they're like, hey, I appreciate everything you did, but I'm going to go down the street and go work for Applebee's or this place or that place. And there's sometimes no loyalty to what you do. It's just the almighty dollar.
All right, we've talked about the downside. Let's talk about the upside. You've had some success with the legislature. What's that about?
Well, I mean, the governor and his people did do, they had $146 million in state grants, which helped a lot of people survive. Our licensing fee, they eliminated them in 2021. They allowed us to sell mixed drinks to go during the pandemic to help us with some revenue streams, which was huge. They've lessened the off-premise catering so that it's not as stringent requirements to cater a wedding or something like that. So there's a lot of things that they've done for us. I just think there's a lot of things that need to continue to happen because of the situation that we're in. I don't see COVID going away anytime soon.
One other thing you talk about is House Bill 1497 from Representative Jones that encourages the use of outdoor space and sound. What's that about?
Well, so a lot of bars have live music, whether it's acoustic music, live bands, or whatever. And Mike Jones's bill basically states that, you have
No, go finish your thought.
Okay. You have breweries and stuff that are allowed to have outside music, but bars and restaurants aren't.
Okay, they're in my ear. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.